The first thing I want you to know about is just the fact that this is always going to be a team effort.
Deep brain stimulation involves placing very tiny wires in someone's brain to interrupt broken networks. The goal is to give someone more mobility or to allow them to feed themselves. Basic things that we take for granted. These broken networks can manifest as tremor. Sometimes people have Parkinson's disease or dystonia, which is a twisting of the neck or other parts of the body.
I look at the treatment options and I look at their condition at a time, and I make the decision if this is the time for them to move forward for this procedure. You do need symptoms for at least 4 years. The other indication for surgery is when someone has severe tremors, those involuntary movements that you could not control with the medication that you already have.
When we're doing the surgery, we have a plan for how we need to get to this key spot in the brain, and that's guided by the scans that we've done before the surgery. So we've chosen a target and we've chosen a way to get there in a safe way. We place very, very, very tiny electrodes into the brain to measure electrical activity. So it sounds almost like static on a radio when it's coming through. And that's literally the neurons in the brain firing. We understand based on the sounds of the neurons firing where we are in the brain. Based on that information, we actually stimulate the different parts of the brain. And that part of the surgery is the most dramatic. You start to see the difference between before and after stimulation. Someone might have a debilitating tremor beforehand, and once we start stimulating, you can see that tremor just go away. Some people think that it's experimental, but it's been around now for about 50 years, and actually FDA approved for 30 years or more.
When they show up in the clinic, this is roughly a month after the wires and maybe 2 weeks after the battery was connected. We just turn it on. Usually when you turn it on, they're supposed to be at 0, so you don't feel anything. And then when we choose to stimulate, we have 3 things that we could change. One of them is how strong is the impulse. The other one is how often you deliver that stimulus. And then the third, for how long do you deliver the impulse.
The idea with someone with Parkinson's disease is to improve their quality of life for a minimum of 10 years. It helps not just tremor, it helps with slow movements and really rigid movements. And after we start stimulating, you start to see those movements become smooth and fluid. There's a profound impact on the patient's overall health because the burden of the disease is so much less.
We don't understand. Maybe some of us once in a while may take some supplements. Imagine for you to take 2-3 times the medication, 2-3 times a day. That's the best scenario for Parkinson's disease. So just taking that burden away, some people can start thinking better.
I've seen patients where they're just thrilled to be able to go out to a restaurant. It's like your tremor's gone or you have more fluid movements now. What are you going to do? And literally from the clinic, they say, I'm going to a restaurant because I haven't eaten at a restaurant in 3 years. We're talking about not just improving people's quality of life, it's also improving their sense of self. The great thing about Geisinger is we have all the components of the team necessary to do these surgeries. The beauty of it is just being able to get the best care possible close to home.